Brimonidine 0.2%, Timolol 0.5% eye drops are used to treat high pressure inside the eye caused by conditions such as glaucoma or ocular hypertension. By lowering the high pressure inside the eye, these eye drops help to prevent blindness. This medication contains brimonidine and timolol, which work together to control the pressure inside the eye. Brimonidine allows better fluid drainage from within the eye and decreases the amount of fluid formed in the eye. It belongs to a class of drugs known as alpha agonists. Timolol works by decreasing the amount of fluid formed in the eye and belongs to a class of drugs known as beta blockers. It's important to note that this medication is not recommended for use in children less than 2 years old due to an increased risk of serious side effects. Be sure to ask your doctor or pharmacist for more details about the proper use and dosage of Brimonidine 0.2%, Timolol 0.5% eye drops. Before using Brimonidine 0.2%, Timolol 0.5% eye drops, make sure to read the patient information leaflet from your pharmacist. When applying the eye drops, be sure to wash your hands first to avoid contamination, and do not let the dropper tip touch your eye or any other surface. If you wear contact lenses, remove them before using the eye drops and wait at least 15 minutes after using the medication before putting them back in. Tilt your head back, look up, and pull down the lower eyelid to make a pouch, then place 1 drop in the pouch as directed by your doctor, usually 2 times daily, 12 hours apart. After applying the drops, gently close your eyes for 1 to 2 minutes and place a finger at the corner of your eye to apply gentle pressure, which will prevent the medication from draining away. Do not rinse the dropper, and replace the dropper cap after each use. If you are using another kind of eye medication, wait at least 10 minutes before applying other medications, and use the eye drops before eye ointments. Use this medication regularly at the same times each day to get the most benefit from it, even if you feel well. Most people with glaucoma or high pressure in the eyes do not feel sick. Some common side effects of Brimonidine 0.2%, Timolol 0.5% eye drops. Ophthalmic antiglaucoma agents may include temporary blurred vision, burning, stinging, itching, redness of the eye, watery eyes, dry mouth, feeling as if something is in the eye, headache, dizziness, or drowsiness. If any of these side effects persist or worsen, it is important to inform your doctor or pharmacist promptly. It's important to remember that your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. You should contact your doctor immediately if you experience any serious side effects such as vision changes, eye sensitivity to light, eye pain, swelling or discharge, slow or irregular heartbeat, muscle weakness, unusual tiredness, mental or mood changes, coldness, numbness, or pain in the hands or feet, swelling of the ankles or feet, sudden unexplained weight gain, or shortness of breath. Seek medical help right away if you experience very serious side effects, including dizziness that does not stop, trouble breathing, chest pain, weakness on one side of the body, trouble speaking, confusion, or fainting. Although a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before using these eye drops, make sure to inform your doctor or pharmacist if you have any allergies to brimonidine, timolol, aproclonidine, or any other substances. It's important to talk about any medical conditions you have, such as lung disease, irregular heartbeats, heart disease, kidney or liver disease, blood vessel or circulation disorders, diabetes, depression, overactive thyroid, muscle weakness disorders, severe allergies, or if you are pregnant or breastfeeding. If you develop an eye infection or injury, or have eye surgery, check with your doctor about whether you should continue to use your current bottle of this medication. It's important to also inform your doctor or dentist about all other medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. This medication may affect your blood sugar levels, especially if you have diabetes, so it's important to monitor your levels regularly and speak to your doctor if you notice any concerning symptoms. This drug may also cause dizziness, drowsiness, or blurred vision, so it's important to avoid driving or operating machinery until you know how this medication affects you. If you are pregnant or breastfeeding, make sure to discuss the risks and benefits with your doctor before using this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. Certain medications may interact with Brimonidine 0.2%, Timolol 0.5% eye drops, including beta blockers taken by mouth, certain antidepressants, digoxin, epinephrine, high blood pressure medications, and quinidine. It's important to inform your doctor or pharmacist if you are using other products that may cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Additionally, be mindful of the ingredients in other medicines, such as allergy or cough and cold products, as they may also cause drowsiness. It's always best to check with your pharmacist about using these products safely. If this medication is accidentally swallowed, it can be harmful. In case of an overdose with serious symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include trouble breathing and a slow heartbeat. Always be mindful of the proper usage and storage of this medication to avoid accidental ingestion. It's important to not share this medication with others. You may need to have regular eye exams and measurements of your eye pressure while using this medication. Make sure to keep all your medical and lab appointments. Be sure to consult your doctor if you have any questions or need more information. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Be sure to store this medication at room temperature and away from direct light. Keep it out of reach of children and pets. Do not dispose of this medication by flushing it down the toilet or pouring it down the drain unless specifically instructed to do so. When it is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.